So if you get the 11 lines, like I was saying, this is urinary bladder channel, and this is stomach.
Hey everyone, welcome to Hello Hot Flash. I am so excited that I'm here today with Dr. Janet Williams. Dr. Janet, thank you so much for joining me.
Hi, thank you so much for having me. It's a pleasure to be here.
Awesome, great. Again, thanks so much. I'm going to start by introducing you to everyone. So, Dr.
Thank
Janet
you.
Williams is an MD. She's a licensed physician and surgeon practicing in LA. And we just had this conversation that it's all nice and sunny there. And here I'm sitting in the snow tunnel. Dr. Williams is a board certified specialist in obstetrics and gynecology and a member of the International Society for the Study of Women's Sexual Health. She has been helping women find solutions to their reproductive and sexual health concerns since 2001. In addition to her medical practice, she's an intimate life coach, the founder of Intimate Wellness Shop, and the author of the Amazon #1 best-selling book, Why Don't I Like Sex Anymore? I can't wait to get to that. But before we get there, I want for you to introduce yourself to our audience.
Hello, everyone. Again, yes, I'm Dr. Williams. You can call me Dr. Janet, but I've been in practice for over 20 years, working with women in obstetrics and gynecology, surgery. And about 4 or 5 years ago, I launched a business called Intimate Wellness Shop, which is an online resource for all products, intimate health and wellness. And that was born from a need repeatedly that my patients were coming to me, hey, do you have any product recommendations, things that we can use, things that don't necessarily have hormones in it, or non-pharmaceuticals. And so I was looking for ways to help women with their autonomy in their healthcare. And that's where Intimate Wellness Shop was formed. And now I've taken it a step further because the next question is, how do we, recapture our intimate lives? I kept seeing women over and over, complaining that they've lost their libido, that, things aren't the same. And especially for women, midlife women entering into perimenopause and menopause, there was a sort of recurrent theme where, there's issues happening with their bodies and their sex and sensuality. And so I wrote the book, Why Don't I Like Sex Anymore? And I have a coaching program to help women to recapture, that very important and vital part of our lives.
Wow, that's very interesting.
Yeah.
Tell me why the field of medicine? What made you want to go into medicine and then more specifically obstetrics? Gynecology.
Well, I do come from a medical family, and so it was sort of not like a limitation. It wasn't something that I didn't think that I could do. So that's a big, thing for a big barrier for a lot of people when you don't think that you can do something.
Yeah.
So it wasn't ever something that I didn't think I would be able to do, but I've always enjoyed and loved science. And I love the humanity of interacting with people. So that, was what brought me to medicine in the first place. And then trying to figure out between the different rotations and different options of specialty. I was actually initially interested in general surgery because I actually enjoy the surgery aspect of things, and being able to go in and like correct something, fix something, and leave someone feeling better than when they started. And then I also was interested in family medicine because it was sort of the day-to-day things that you encounter, the working one-on-one with people and working through their, chronic illnesses, like regular day-to-day medical problems that occur. And somehow obstetrics and gynecology was sort of a blending of the two because, in obstetrics, we take care of pregnant ladies, we deliver babies, we do surgery, hysterectomies, we deal with, bleeding issues. All of those things kind of came together for me and made it the perfect field to work in it. And when I did my first delivery, I cried. So
Was it a
it
happy
was
cry?
a happy cry. It was just a beautiful thing. And so that's why I landed where I did.
Yeah, I've heard that. I have a good friend that's an OBGYN that it becomes physically tasking on your body as well. Delivering the babies, and it's a lot of work because you cannot say at 2 o'clock in the morning, I do not want to go to the hospital.
I know. Yeah,
Like that
definitely.
work.
Yeah, it is. It's actually kind of grueling, and I think it changes. You know, when you're 22 and up at 3 o'clock in the morning, it's a whole different scenario than when you're 42 and up at 3 o'clock in the morning. It's a different world. So yeah,
Yeah.
definitely.
So from knowing that you always could be a doctor to becoming a doctor and then writing a book, what made you want to write this book? And then tell us about the book.
Okay, yeah. So really, it came down again to my patients, and then some personal experience as well. So, you know, in medical training, at least when I was coming through, there was not a whole lot of guidance when it came to sexual health and sexual medicine. And it's funny because, you know, I would talk to people and I tell them, oh, I'm a gynecologist, and they're like, oh, well, tell me about a sex position. And I'm like,
What?
I don't know anything about I don't know anything about that. You know, we didn't really get trained on, you know, sexual health and wellness, how to, you know, have pleasure, like what comes in the way of pleasure, what to expect when with libido and changes in libido. And I had, you know, women just coming in on a regular basis, people in their 30s and their 40s and their 50s, you know, suddenly not having, you know, pleasure with sex, having pain with sex, or having a loss of libido. And I didn't really know how to guide them. You know, I would ask my colleagues and they would say, well, you know, after a certain age, you just can't do it anymore. Or the answer would be like, oh, they just need to get into some sexy lingerie and, you know, have a date night. But that wasn't really the issue that was, you know, occurring. You know, it was actual, you know, changes in people's bodies and in the way they were feeling that was interfering with their sexual wellness. And so, you know, that was the biggest part of the sort of impetus to write this book. And then I also had my own, you know, problem, my own journey with infertility that led to some problems and changes in my body that ultimately affected my libido and my and I had, you know, problems with sexual pain, and all of those things influenced me writing the book. And so you asked the question of what is the book about? So it's really about why some of these things are happening. Why is it that we have changes in our bodies, and explains our bodies? There's a little bit of adult sexual education in there, which, you know, look, for most people in their 40s and 50s, they probably had like a 1 hour lecture in the 9th grade or 8th grade.
Yeah.
And that's pretty much it. If you come from a conservative background like I do, your parents were like, you know, deer is caught in headlights when you ask them about it.
Right.
So for a lot of us, you know, there's a lot of shame around sex and sexuality. There's a lot of misinformation or just never having gotten any information about it. And that's really what it's about. And helping women to realize that it's actually normal and common to have these issues that come up. And then giving us some tools on how to navigate and get that back. I believe that our sexual pleasure and joy is something that is innate, and something that is natural, and something that is our divine right to have access to.
How have you, so as women begin to age, they go through perimenopause, menopause, are you seeing a huge difference in the conversations that you're having with a woman maybe in her late 40s, early 50s than the 25 to 30-year-old? Or are you seeing that there's common conversations that you're having with people as it relates to their sex and their sexuality?
Right. Yeah. I think one of the biggest like common threads that we'll see is that stress is a big factor. Okay, it's a huge factor, and it can be like a total killjoy when it comes to sex and sexuality. And I think that for different stages of life, there are different things that are, causing you to be stressed.
Right.
And it runs the gamut, like even from, the standpoint of medical racism, for example. There's lots of minority women who are looking for a physician who can kind of understand their background, will hear them out. And if they've got some sort of physical problem, and they can't find anyone that they trust and feel comfortable with, that's a barrier. That's a barrier, and it's a stressful thing that we don't really talk about, but it will influence things.
Mhm.
Again, other things in your stage of life, if you're having children, you have a young kid, a toddler that you're taking care of, that's going to really get in the way of things if you're ripping and running, if you're a working mom or if you're a stay-at-home mom and you've got all of these responsibilities. It definitely can affect things. And then the stresses for an empty nester, for example, sending your kid off to college. Like I have an older sister, and she just sent her middle son, my nephew, off to college, and it's like it's a rough thing. It's like it's a tough thing to let your baby go, and it has an effect on your full sense of self and what are you doing, and that can definitely affect and impact relationships and your sexual health. So those are the common threads that we see, regardless of age. Stress is a big one, depending on where you are in your life and the things that are impacting you.
And I'm so happy you said that, because a lot of times people don't associate those two. They think,
Yeah.
okay, I'm just having a problem, I'm not sure what's going on, and not recognizing that there is stress in the home, or stress in your life, or just stress period all around us in our job and our workplace. And sometimes if we learn how to handle that, everything else starts to work out a little bit better for us. So I'm very happy that you brought that up. You run the gamut of really thinking about what a woman needs in order for that woman to grow and to feel comfortable in their body, feel comfortable with their sexuality, to the point that you've also become an intimate coach. So tell us what that is, because that's probably, I just learned that in probably the past 2 to 3 years that thing even existed. So for the women who don't know what an intimate coach is, tell us a little bit about what you do and how that type of coaching could help them.
Right. So I always liken it, there are life coaches, there are personal trainers, there are business coaches, and all of these people are instrumental in helping you to reach a goal, right? So if you have the goal for weight loss, you're going to work with it, and building some muscle, right? You're going to work with a personal trainer to get the right meal plan, to get the right exercise regimen, to figure out what things are standing in your way. Like, are you not going to sleep on time so that you can get up and do your workout? Are you not drinking enough water? All of those things, that personal trainer will help you to reach the goal of your weight loss and, your muscle definition, for example. A business coach, you want to get, up level your career. You want to get that next position. You need to have the speaking skills, or you need to figure out what, extra software programs you need to be aware of in order to get to this next level. So you work with a business coach who has experience and has options and recommendations for you to pursue, figure out, and define what your goals are. So the same is true for an intimate life coach. So we're looking at all of the parts and pieces that factor into your intimate health and wellness. And so I kind of have a unique standpoint because I am an obstetrician gynecologist and I have a full understanding of what's going on physically. But I'm also very attuned to what's going on emotionally and life circumstances and how all of those things play in. And so when a client comes to me, I want to identify exactly what her goals are first, and what is she trying to obtain, because everything's different for every person.
Right.
And then we go from those goals and we figure out what it is that she needs to reach them, and then we'll go through them and help her reach them. When I decided to become an intimate life coach, one of the things for me when I was going through my problems, I was looking into, what kind of options are out there. And the funny thing is there's some crazy stuff out there too. There's like sex workers that like do vaginal weightlifting. And I mean, from that to like witches, like, I mean, all kinds of stuff that I'm like, no, that is not, that's not what we need. We need like, real information. We need medical, like supported, information. And then someone who has the time and dedication to actually help a person one-on-one or in a group setting. So that's kind of, I'm trying to reach those people who don't want to do vaginal weightlifting, like, okay, that's fine.
That's a thing, okay?
It's a thing, but, it's not for everyone. And like I said, if you grew up in a time or with a family that was very conservative, or, there were no conversations around sex, you're less likely to be on that spectrum of wanting that type of information. And it's fine. I think there's room for all of it. But I think that there's a need for somebody to guide people who are more on the conservative side of things and just really want to understand their body and get back to some pleasure.
Yeah, I love that. Yeah. So what should every woman do to improve their intimate life besides removing the stress?
Yeah. Well, I think it's important, and I talk about this in my book, to have a self-care regimen. So something that you're doing, and self-care is really, it's not about like, masturbation or, that kind of thing. That could be a part of it, but it's really more about getting in touch with yourself emotionally and then tying that into your body. Sex is a very multifaceted, multifactorial thing. And so sometimes we disconnect, we don't like put the two pieces together. And so self-care from an intimate wellness standpoint is about connecting your emotions into your body. And our bodies actually carry a lot of emotion, and sometimes we don't even realize it. But if you think about it, like the tension that's in your back or neck, you're like hunched over on the computer and people are moving around and they're like, oh, my back. The same thing happens in the pelvic floor, It may be different emotions, it may be trauma, it may be other things that are going on that are being held down in that pelvic floor. But there is that mind-body connection. And so self-care for me in terms of, taking care of and improving your intimate health is about that connection.
You mentioned this a little bit earlier, how some women present with sexual pain. They don't understand what's going on and don't know how to relieve that pain. Talk to us a little bit, and more specifically to the woman who right now may be sitting, listening to this episode and be suffering.
Right. So sexual pain can actually catch people off guard, and it can make them think that, maybe that's it for me, maybe no more sex for me. And for women, and so for some women who haven't been sexually active or haven't had much sex, sometimes this deters them, from having sex in the future, because they're like, this hurts, I don't like it, doesn't feel good, what's the big deal, I don't get, maybe I'm different. But that is not necessarily the case. And for most women, sometime in their life, they're going to have some sexual pain. The problem is that there's so much shame around it that, people may not ask for help. They may think that there's something wrong with them inherently. But, there's a number of reasons that you can have sexual pain. For women in perimenopause and menopause, and then also women who are on birth control pills, there can be a decrease in the estrogen levels that are in your body. And so estrogen is very important in the lubrication, the moisture, of the vaginal and vulvar tissues. When you're on a combined birth control pill, even though there's estrogen in that pill, it can also like knock it all the way down just because of the way the concentrations are in your body. Mm-hmm. Same thing for the Depo-Provera injection or any of the mini pill. If you're breastfeeding, the estrogen levels are very low. So all of these things can affect the estrogen in your body and as a result cause vaginal dryness, vulvar dryness, which can result in friction and pain. And it actually changes like the texture of the tissues inside of the vagina, and that you know, would need some lubrication or even like a vaginal estrogen cream to rejuvenate those tissues safely and get rid of some of that pain. So that's probably the most common cause of, you know, pain, sexual pain that women in their 40s, 50s, and beyond will encounter. And the great thing about this, I love to tell older women about this, is that there's something that can be done about it. Yeah. And you can actually get that tissue to act and function like the way it should be. Other things that may affect pain are like the pelvic floor. So I was talking about those muscles, like if you have tension in your back, it's tight, uncomfortable. The same thing happens with the pelvic floor. It's like a basket weave of muscles. And if those muscles get really tight, ouch, nothing's getting in there. You know, it's a very painful thing. And so there's, you know, physical therapy. There are, you know, tactics to relax those muscles. Some of it is some, you know, mental work, some working through some of the, you know, things that are causing that tension. But there are definitely options. And then this one's a big one for a lot of women of color who suffer with fibroids. Mm-hmm. Fibroids can cause deeper pain if you've got cysts, any kind of structural thing that is deeper inside. That's what you'll see more association with like deeper pain. So that looks like you're in the midst of intercourse and ouch, all of a sudden you're, hey, you got to get off me, kind of thing. So those are just some of the causes of, you know, pain. And then some other things that are a little less common are like actual nerve issues. So you can have problems anywhere along the spine, and then the pudendal nerve, which is a nerve that innervates the pelvic floor and the skin of the vulva. So there's, you know, different things that happen there. Vitamin deficiencies. If you've got diabetes, you're a higher likelihood of having some of the issues that happen in the nerves. They call it a neuropathy, where you're having, you know, pain, tingling, or problems of with numbness in the nerves of the pelvic floor.
What I love about this conversation is it wasn't one simple blanket solution that you offered. And I know a lot of times when we don't know how to be our own advocate, or we don't know what questions to ask, when we get that one response, we're like, okay, the doctor said it, that has to be it. And then we leave it at that. But you've given so many different things that I think that I hadn't thought about. And I know that many audience members may not have thought about either. So I hope that while you guys are listening, that you're, you know, go back, take a couple of notes, and if your doctor's not responding to you, find another doctor is what I often say, because you need someone that you can have that relationship with so that they will help you solve the problem. Because in most cases, there are some very basic solutions that that can be done in order for you to begin to feel better. So yeah, I love that. So in midlife, another thing that women often speak of or have concerns about are low libido. So talk to us a little bit about that, and if you have a list of solutions for us as it relates to that as well.
Yeah, low libido is probably the one of the most common concerns that women in midlife come in with. And again, it goes back, it's multifactorial, and it goes back to the time of life and what's going on during that time of life. Right. Like I said, empty nesting, there's a lot of stress that goes around at that time. If you have elderly parents, you're worried about your parents, like somebody might be sick, like your husband or a partner may, you know, have their own, you know, sexual issues going on. And so it's hard to get in the mood when you have all of that going on. So and libido, when we say libido, we're really talking about desire. And so, you know, it's desire in a combination of arousal. Desire is, you know, like you're wanting to have sex.
Right.
And then arousal is your body's like response to like sexual stimuli. So like if you're getting moist when you see something exciting, that's more of arousal. And then desire is like, ooh, I want to have sex. Like, or you may initiate, or you may be responsive to like some initiation from your partner. So they kind of blend in a little bit. But so from the desire standpoint, it really involves a lot of the stuff that goes on in the head.
Mm-hmm.
And so it's work around that, but it's not just your head and like your thinking. It involves like things like sleep, right? So if you're not getting good sleep, think about if you had a presentation tomorrow, right? And for some reason, you know, that your dog threw up on the floor, then you've got, you know, somebody has an emergency and they call you and you end up staying up till 4 o'clock in the morning, right? The next day, you're not gonna be killing it at your, you're just not, you're not gonna kill it. You're not gonna be on point. Your presentation is gonna be a little wonky. You might have forgotten one of the slides. It's just not gonna work out, right?
Yeah.
And so for a lot of women, it's tying into all of the things. So the stress, if you're having hot flashes that are waking you up at 4 o'clock in the morning and you're chronically fatigued, nobody wants to have sex when you're chronically fatigued. Like,
exactly.
you know, so it's a combination of those types of things that can have an effect. Hormones can have an effect. Some of the studies aren't really clear on exactly how the hormones have an effect, but it may be that if our estrogen is low, we're having more hot flashes, we're getting less sleep, and then getting the hormones back improves the sleep and hot flashes, and so that helps with libido.
Right.
So, you know, it's a combination of things. A part of where desire comes from is sort of these dopamine releases that happen in the brain and things that like feed into that dopamine release. And so in midlife, there's a lot of times where we're not getting that. And so that's where we focus our conversations around libido.
Awesome. I love it. I've loved this conversation, but I have like 4 more questions for you, but they're really quick.
Okay.
I always like, this has been amazing. This really has. I so appreciate your time, Dr. Janet, but I always want to leave guests with some nuggets. So the very first question is like, what book would you recommend, besides yours, of course, for women to read?
Okay. Yeah, there's a book by the name of The Body Is Not an Apology. And it is by Sonia Renee Taylor. And she talks about loving ourselves like radically and kind of meeting yourself where you are. A part of like dismantling the shame around sex and sexuality is self-love. As Black women in particular, we are kind of battered by the world telling us, oh, you got to do this and you're not good enough, like you're not the standard of beauty, like all of these things that are going into our brains, you know, subconsciously.
Yeah.
And so that book kind of talks about how to separate yourself from that and how to find this thing that I call the ember. It's sort of like a sensual ember. It's like this divine ember that lives inside of us that allows us to realize how worthy we are. You know, we've been hit over the head telling us that we're not worthy, but there's a piece in there that we've got to realize our worth and that we're so beautiful. Like when I came to that realization, it was like a game changer, you know, the realization, because even, I grew up, like I said, I grew up in a very religious household. But even religion sometimes can tell you that you're not, that, we were born sinners and you should be in shame. Like submit yourself down. But I think of it a different way, that God created us and made us these incredible beings that are sexual. We have to like actually have sex to reproduce and have our families. And so it's something that is innate to us. And when you realize that, it flips a switch inside of you. And so I digress a little bit, but I mentioned
you just described the difference between religion and relationship, and that's what we want to have with the Lord, a relationship, not religion.
Right.
So no,
exactly.
Not digress. I loved it. So
yes.
Yeah.
So that that book is like good for us to realize our worth and to really bring an appreciation for our bodies. And that would be one I would recommend.
Awesome. And I know in your book you talk about the ember as well. I was able to read some of it, and I'm going to make sure you guys that you get a free copy of the book. There will be a link in the show notes for you, as well as a link to The Body Is Not an Apology. I'll get that, and I'll link that as well. So awesome.
Yeah. So yeah, just so you know, it's just whydon'tIlikesexanymore.com is where you can get that, and it'll be like she said, it'll be in the show notes.
All right, awesome. Yes, thank you for letting us know. What is one no cost thing that the Hello Hot Flash audience can do for their mind, and one no cost thing that they can do for their body immediately?
Okay. So, as a part of the self-care, so I have a thing where I break down the self-care. So the S is for I forgot. Okay, well I'll skip to that. But the A is for affirm. Okay. And so I recommend a practice of affirmations for yourself. And it can be as simple as in the morning, you look in the mirror and you tell yourself, I am beautiful. Mm-hmm. Or if you don't feel beautiful, you look at your body and some part of your body and you say, thank you for, carrying me through the day. Thank you to my legs. You are beautiful. You've carried me for these years. Thank you to my eyes for opening up and seeing where I need to go. Mm-hmm. And so these sort of affirmations, it sounds a little silly, but over time, it does give you an appreciation for yourself. That's free, and you can, on a daily basis, like reinforce that notion to yourself. So that would be the mind hack that I would give.
All right.
And then the other question was
the same thing, but for your body. What would you
for your body?
For your body.
Okay. So this is like something that everyone says, but for blood flow, blood flow is important to the genital region for things to activate and do what they're supposed to do. And some of the best things for blood flow are making sure you're hydrated. So drink your water and then exercise. So, and it doesn't have to be hardcore P90X. Like you don't need to drop 100 pounds. Like you just need to move, like do a little movement. And I talk about embodiment, and what I mean by embodiment is giving attention to the area that you're moving. A lot of times people will, jump on their, Peloton, or they go do some sort of exercise and zone out. Yeah. I recommend that you zone in and think about that area. They've actually done studies where people who are thinking about flexing their arm actually build muscle tone, even though they're actually not flexing their arm. Yeah.
I'm gonna be like,
yeah, no, but it's the truth. It's the mind-body connection. If you think about it, like our brains are in charge, right? Yes. They're in charge of, and you can breathe and slow your breathing down and drop your blood pressure.
Very true.
Right?
Yes.
And so the same can be said for other parts of your body. So, do those movements. And when you're doing those movements, just think about your genitals. Like, I know it sounds crazy, but start thinking about that area, and it helps to bring blood and focus. It's just like you think about your foot, you think about your toes. I talk about this more in the book, but like, doing these sort of meditative movements where you're thinking about that location in your body and just zoning in. It helps you to connect to yourself. So that would be the physical thing for flow, drinking the water, and then doing some sort of movement where you're focusing that energy.
Awesome. I love it. Dr. Janet, I have so enjoyed being here and spending time with you.
Yes.
Real quick, tell folks how they can, and again, I'll have it in the show notes, but tell folks how they can get in contact with you.
Okay, yeah, so for the products that I offer, you can go to intimatewellnessshop.com, and we're also at Intimate Wellness Shop on Instagram. For coaching, I am available at goodgroove.com and on Instagram at goodgroove.co. So those are the places you can find me, and I'd be happy to talk more about it.
All right. Thank you once again. Have a
Thank
marvelous
you.
day. All right. Bye-bye.
Bye.